Hi, everyone, and welcome to Wellness Wednesday Live with Healthy You at Cary Medical Center. We are so excited to be joined today by Josee Romann, who is here with us from the Jefferson Cary Cancer Center. She is an FNP-C, and she has been practicing at our center for several months already, but she came to us from regular family practice. And so we're excited that she's here with us today to discuss some of the issues that people are really concerned about in this time where we're kind of confined to our homes and worried about this virus that's going around, and everybody knows it by name, and it's everywhere. We just can't get away from it. So I'm sure that as a practitioner in the cancer world, you're seeing a lot more people who are genuinely concerned about this because they have these pre-existing conditions that people are warning us are more predisposed and more vulnerable to it. So why don't we start by, maybe you can tell us a little bit about your practice and what kind of cancer care you are handling.
Yeah, I'm really excited to be here. Thank you, Bethany. So basically our cancer center tailors to a lot of people. We're also a hematology clinic, so we do see people with some blood disorders like anemias and things like that. We offer basically a lot of supportive care to cancer patients, along with people going through active treatment. We have an infusion center that we give the chemotherapy and also immunotherapy and to patients that are actively going through treatments. We coordinate a lot of their care downstate and also going through radiation oncology. So there's a lot of different things that we help to coordinate and bring to people here in the county, because it is a far distance, and we try to do that as much as possible and keep people.
Awesome.
Local.
So how affected the clinic there at Jefferson Cary Cancer Center and the patients? What are you seeing when they come in? What are their biggest concerns?
So I think a lot of their biggest concerns are basically what everyone's worried about. How do I protect myself? Especially people going through active chemotherapy, they're significantly at a greater risk of potentially contracting this virus, and also being significantly more affected if they do get the virus. I've been reading some statistics that basically people that have a history of cancer could be 5 to 7% more likely to basically have a mortality rate, die if they contract the disease. So we do a lot of education to our patients about making sure they do a lot of hand washing, soap and water over gel, if they're able to, but obviously gel is the next best thing. Hand-based sanitizers, if they don't have soap and water on hand. Basically trying to limit anybody coming through the house besides your immediate family members that live in the house. We're not talking about your mom and dad that live down the street or your brother and sister that live in the next town over. Even though you may have seen them before, we're basically saying nobody from outside the household may come and visit you. And if you do see people, then obviously keep the 6 feet away if you're going to be talking with them, because this is basically a very serious thing that can potentially take our patients' lives. So we do advise a lot of caution. If they go out in public, we do advise that they wear a mask if they're able to. If not, then we advise other members of the house to go out and do the errands or the grocery shopping for them. And obviously when those people come back, that they immediately wash their hands and do what they can to clean themselves before they have interactions with the patient again.
So are you still able to do all of the treatments that you normally would do? Are you doing like a full, I guess they would call that like a caseload of patients, or have any of those services been disrupted by the current pandemic?
Yeah, so there is basically a risk to delaying services with patients actually actively going through chemotherapy. We do our best. If we are able to delay or limit our patients coming in, then we do that. Like a lot of our survivors that we follow up on, down the road, basically we do call them up and give them options of either virtual visits through Zoom or some sort of platform like this. And if basically they aren't able to do that from home, then we do give them the option to reschedule at this point in time. Unfortunately, like a lot of our people that are actually going through chemotherapy, unfortunately, we're not able to do any sort of virtual visit because it's all basically we have to do lab work and we have to do workup before we actually end up giving them the chemotherapy. And obviously that can't be done from home. So we try to do our best to protect our patients. As workers coming into the hospital, we are screened ourselves. We have our temperature taken every morning. Currently, the hospital is mandated to wear cloth masks, but since I'm alone in my own office right now, I'm not wearing mine. But basically, it is one of those things that we do everything that we can to protect our patients from this virus. And if we have a case where potentially someone has been exposed to the virus, we have a separate area and a separate room where we can see these people and still try to give them what they need. However, if they're actually having symptoms of any cough, cold, flu symptoms that they may have, it is an indication to delay chemotherapy anyway. So we're very careful to screen our patients and make sure that that we don't inadvertently harm them throughout all this.
Now, is there a difference between the risk for someone who's, say, in active treatment as opposed to someone who might be, you know, a 10 or 15-year cancer survivor? What have you heard or learned about those risk factors? Are they equitable, or is there a dramatic difference?
I think at this point in time, we kind of have to assume that there's an equitable risk. Even though some people may have been recovered and had gone through chemotherapy, like you said, 10 to 15 years ago, we just don't know enough about this virus to know if it's a significant risk. So we have to kind of assume that everyone's at an increased risk that's gone through cancer before. Same thing goes with any sort of cardiovascular issues or diabetes and stuff like that. So
Yeah.
especially
I would assume some of the cancer treatments cause that collateral damage, that people deal with some extenuating what would be considered pre-existing conditions as a result of some of those treatments that they might have undergone. So I guess that it makes sense that it would be similar for those. Have you had any other kinds of questions or concerns related to COVID-19 come up in the practice that you would want to share, or anything that you may not have time to speak at length to your patients about when they're coming in, especially in this time, or anything important that should be known?
I think basically just the biggest thing is that I think everybody has a different level of taking this seriously. I mean, we have some people that are taking it very seriously, and we have some people that, I mean, it's here, they hear about it on the news. Obviously, we haven't had any cases at our hospital that I know of yet, but again, it's not necessarily for that people may not be having symptoms, it's just we haven't had a positive test yet. So it's one of those things that this is something that we need to take seriously. We have a significantly older population in the county. Basically, when you look at the CDC website, the main CDC website, it's at least 25% of people that are 60 and older that are getting affected. So, I mean, it's a big concern. And a lot of our patients already are in that population zone, on top of having all of these extra comorbid conditions that it's worrying us as healthcare providers to make sure that we don't expose our patients unnecessarily.
For sure. And, I guess one thing as a cancer advocate that I would stress too, that if anybody is kind of dealing with some of the extra stress and emotional, mental issues that go with being in the midst of potentially cancer treatments or survivorship in whatever stage, we're not alone. And I think it's important that we continue to stress that message, that even though we're physically distant, that we need to be connecting with other people and connecting with our networks of support and reaching out there. I mean, we're offering this month some online cancer support groups, but there are people, groups all over the world that are offering online groups and meetups and different ways that you can connect with people who might be dealing with similar stress to what you as a cancer patient or survivor might be living with, especially in these times. So, that mental health component, I think, is even more important for someone who's already not feeling well and dealing with the stress of that and then this on top of it. Mm-hmm. So hope that your patients that you're seeing are connecting and able to get that emotional support that they definitely need during these times.
Yeah, that definitely it. We do spend a lot of time, and we always encourage our patients to give us a call if they have any concerns. I mean, we'll take the time to basically answer your questions and try to alleviate your concerns as much as possible. And if we're able to make some sort of compromise, if they're worried about coming in, then we absolutely try to do that as much as possible.
Well, thank you so much for being here and for spending some time with us. And we look forward to learning more about cancer and different ways that we can connect throughout this month, all through the month of April on the Healthy You Facebook page and with other programs that we'll be offering. So thank you again, Josee, for being here and for your willingness to share on this really important issue that's pressing on so many of us. And for the rest of you, we'll see you back in a couple weeks on another Wellness Wednesday Live.